Namaskar friends, I am Shubhra Sinha, your course instructor, and this is lecture 3 of module 7 of the stress management course. In this module, we are learning about how chronic health problems can be a source of stress and what can be done in order to alleviate that stress. In this particular lecture, we will learn about two important cognitive factors, that is locus of control and attribution style. Both these factors have a lot to do with how we perceive our stress and how do we perceive the possible outcomes of our actions that we take in order to manage our disease condition. Attribution style and locus of control are two important cognitive variables which have their roles in almost all kind of cognitive assessments, no matter where we do them. First of all, if I talk about the locus of control, it means where the control point lies. Control point of what? Control point of the events which are happening in your life. Whether the control is in your hands, whether whatever is happening is an outcome of your own actions, or everything is in the hands of some external factor. Making this distinction between the internal factors being responsible for the life events or external factors are responsible for whatever is happening in the life is something very important, as it has a long term impact on the way we deal with the situation. We will talk about it more, but here let me introduce a closely related factor known as attribution style. Attribution style is basically how we interpret the actions happening in front of us. What kind of reasons are we going to attach with whatever happens in our life? Again, these factors can be internal, they can be external, or there may be a mix of both internal or external factors. What happens that attribution style is the way in which people make sense of the causes behind the various outcomes, positive or negative, successful or unsuccessful, desirable or undesirable. Mostly we have a tendency to attribute positive things to our internal factors and negative things to the external factor. However, the relationship is not that simple, rather it is very much complex when we start discovering deep about these things. Still, if we look at it in a very simple manner, then attributing positive things to oneself and negative things to the environment helps in maintaining one's self-esteem and self-confidence. For example, if I get good grades, this is due to my efforts which I have put while preparing for the examination. If I do not get good grades, it is because of the unexpected level of difficulty of the paper, or maybe the examiner was too strict to give good marks to students. On the other hand, if I start attributing negative incidences to myself and positive to external factors, it may lead to a sense of helplessness and depression. This is one of the major causes of the clinical depression. So, people who suffer from this kind of situation, they usually attribute all negative incidences to themselves, viewing them as being too much incapable, completely helpless in managing anything, almost anything. Now, how does it apply to health related psychology? If I develop a disease, whether this development is an outcome of my own faulty lifestyle or my own actions which somehow went wrong, or it is a result of the gene pool which I have inherited from my parents, or it is a result of my past karmas. If it is a result of my own lifestyle problems, I can take corrective measures. I will be more motivated to take corrective measures, because if faulty lifestyle can lead to diseases, healthy lifestyle must bring it back, at least to some extent, if not fully. But if it is a result of my past karmas, what can I do about it? I simply have to bear it, tolerate it, and instead of sticking to medical treatment, I may turn myself towards offering worships, observing fasts, trying to get connected with the Almighty, so that the influence of my karmas can be mitigated and I can overcome the disease I have developed. My attribution of the disease condition leads me to do different course of treatment. One goes towards hospital, another goes towards temple, or both the things can be done simultaneously. And in India, we find mostly the two interpretations coexist. That is why you find people observing fast and performing various kind of rituals while also taking medicines prescribed by the doctor. So, this particular phenomena is known as coexistence. However, what I was trying to highlight here was the way I attribute the development of disease, means the potential cause which I like to suggest as a basis of that particular diseased state will tell me what to do in order to manage the situation nicely. Similarly, locus of control is another such thing. If I continuously attribute important happenings of my life to internal factors, I will develop a style which is called internal locus of control. That means I have a habit or a predisposition to find my own self being responsible for whatever happens to me in this life. On the other hand, if I am predisposed to attribute the significant happenings to the external factor, which could be Almighty, which could be any situational factor or even my past karmas, I am more inclined towards having an external locus of control, where the things which are happening in my life are being regulated by external agencies and not by my own actions. These two different locus of controls can give me different insights for future actions. If I find myself as the in charge of my life, I will be taking steps proactively and reactively in order to rectify things, to put them back into normal state, or at least try to reduce the suffering and stress as much as possible. On the other hand, if I find external agencies as the control power in my life, and whatever happens in my life is simply an outcome of the interplay of those external factors, I may develop a sense of helplessness and hopelessness. If I can't do anything, if nothing is in my hands, why to take action? And this can further lead to a passive style of coping, where I focus more on tolerance, where I focus more on bearing whatever happens in my life without being very active in changing the situation. I will focus on changing myself, especially the cognition and emotional part associated with the things which are happening. This is what is exactly given here, that is, an inner locus of control can empower individuals to handle stress more effectively, as it fosters a feeling of autonomy and empowerment. However, these conclusions can be taken with caution in different situations and with different individuals. The interaction of locus of control and attribution style can come up differently. So, sometimes, for example, when we suffer from, and God forbid, but if someone suffers from a terminal illness, then connecting oneself to the supreme power gives him more relief than continuously taking actions and getting disappointed with their outcomes. Okay, so when the disease is in a state which is very severe and there is almost no hope or very little hope to recover from that state, just releasing everything and trying to yield to some sort of supreme father usually gives better relief to people. So, it depends upon what kind of disease is there, at which state the disease is, and the individual's psychological, social and cultural backup, values, belief systems. They all taken together will decide what kind of locus of control would be better able to reduce the stress in the present condition. So, when it comes to coping, we find that internal attribution for negative events is usually connected with an external locus of control, that is, one himself or herself is not able to control the life events which are of importance for the person, and therefore, the ability to cope with the situations may suffer. On the other hand, if a person has an internal locus of control and he attributes successes or positive things of life to the internal factors, usually more than what he or she does with the external factors, then a sense of control, a sense of empowerment is there in the individual. It leads to increase in the self-esteem and self-confidence, thereby making the individual better able to cope with the situation. Now, what happens when we have a particular type of attribution style or locus of control? It has a deep correlation with the futuristic outlook of a person also. For example, and an attribution style which is attributing negative events to internal factors and positive events to external factors, along with an external locus of control predominantly, can lead to a pessimistic future outlook of the individual, and vice versa, that is attributing positive incidences to internal factors and having an internal locus of control can encourage or support an optimistic future outlook of the individual. Stress can be better managed by taking into account the attribution style, the locus of control, and the specific condition of the disease. So, accordingly, we can plan an intervention program which is based on the cognitive behavioral therapy, and this may be able to manage the stress nicely in an individual. One must remember that designing the intervention program is a highly individual specific matter. We cannot think of designing a common program for different individuals suffering from different diseases or the same stage or the same disease, but they are at different stages of the disease. So, customization is necessary. Basic principles can be adopted, but the package must be highly customized to suit the need of the patient and the need of the hour. So, that was all for this part, and here is the recap of what we have learned today. Friends, we have learned about attribution style, locus of control, and their dynamic interplay in regulating how we perceive our disease condition and the level of stress we are going to experience out of it. Moreover, we have also discussed how these two factors determine what kind of action we are going to take and how genuinely, how sincerely we are going to adhere to those action plans. Here are the references and the recommended readings for you. A few more books as always are also provided. Thank you very much for your kind attention. Thank you.